Okay, we're connected.
All right. I'm Dave Anderson, and I serve as chair of the Master's Level Psychology Licensed Clinical Psychotherapy Advisory Committee of the Kansas Behavioral Science Regulatory Board. I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. We know David Stevens isn't with us. Ginger Hill.
Present.
Rebecca Jabara.
I'm here. Hi, everybody.
Bruce Johnson.
I don't see Bruce right now, but I'll let you know if I see him in the list.
Okay. Lauren Luck.
Present.
Sarah McMillan.
Present.
Iris Pauley.
I don't see Iris yet either.
Okay. Robert Pedroza.
Present.
Jennifer Schreiner.
Present.
Josh Tangaway.
Here.
And Kari Wold.
Present.
I note the following BSRB staff members are also present. David Fye.
Here.
Leslie Allen.
Here.
Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Dave. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the Executive Director prior to the meeting by sending an email to david.fye@ks.gov. There's been no time reserved for public comment, as no individuals requested to provide public comment at this meeting. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended, so we will be conducting this meeting pursuant to the KOMA. On August 22nd, 2024, we sent notice to the advisory committee meeting to all individuals who had requested notice of such meeting. The notice also was posted on the board's website, ksbsrb.ks.gov. I wanted to let you know Iris Pauley is entering the waiting room, so she should be in attendance here soon. Any individuals may obtain a copy of the notice on the BSRB website. An agenda and other media materials have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And the conference call line is active. I did check it before we got started. There's no one currently on the conference call line, but if someone enters, I will let you know.
Thank you, Dave. The meeting is now called to order, and the advisory committee will begin its discussion of the first item on the agenda. Dave, can you pull the agenda up for me?
Sure.
I'm having trouble getting it.
Yeah, I'd be happy to go ahead and share that.
Thank you.
Okay, I'll go ahead and share my screen here. If the text is too small, go ahead and let me know and I can enlarge the font. Okay. Should be able to see the agenda now for today's meeting.
Yes, thank you. All right, we'll start with any additions to today's agenda.
I did maybe have one. I think a while back we had talked about this, but I didn't know if it still was on the radar. The possibility of people being able to take the EPPP sooner. Say if they pass it at the LMLP level, then I believe there's some kind of wait period. I didn't know if there was anything that could be done at the BSRB level to be able to take that sooner.
That was a topic that we had discussed earlier.
So,
And I'll have to go revisit the notes to refresh my memory at what level that's at. I don't recall if there was a recommendation by the advisory committee or if that had been something that had moved to the board yet, but I don't know that we
know if we move forward with anything on it, but I think it definitely does affect people. I just had one recently, and haven't, when they studied really hard and were really close to passing it, but then can't take it again for 2 years because she passed it at the LMLP level, but then has to wait to do the supervision, I believe.
Yeah, she has to wait until she applies for the LCP.
Yeah, and so, that's 2 years, and it would just be extremely helpful. I don't know if that's at the national level or where that's at, but to have to wait that long is it'd be helpful to be able to take it sooner.
Yeah, I think that's a very good topic that we can definitely bring up for the next meeting in December.
Sure. Yeah.
But I appreciate you bringing that back up. I don't want to lose track of any of the items that we have discussed. I think there were some technical issues involved in the application process is when we're allowed to sort of open up the ability to take the test under our current statutes and regulations. So there would need to be some modifications. I do recall some of that discussion. But if you don't mind, if we can go ahead and just add that maybe to the agenda for the next meeting, I'd be happy to kind of review our minutes, double check what the discussion has been so far, and then come back and be ready to discuss that at the December meeting.
Of course. Thank you.
Sure.
Thank you, Dave. And thanks for bringing that back up. If you do have any comments you want to make sure you unmute yourself and just jump in, because in my current mode, I can only see half of you. So we'll move on to an approval of the agenda. If we can, I would accept a motion.
Move to approve.
Thank you. Second.
I'll second.
Thank you. All right, we have a motion and a second. Any further discussion? Hearing none. All in favor of the motion, please say aye.
Aye.
Okay, thank you.
Aye.
Opposed, same sign. Motion passes. Thank you. Now I can see everybody, Dave, but I lost my agenda.
Yeah, I'll reshare the agenda. I just thought maybe for the voting, it would be helpful to kind of see everyone on the screen.
Thank you. Next is our review and approval of the minutes from our meeting on August 7th. Any additions or changes to the minutes? Seeing none, I would accept a motion to approve those.
Moved.
Second.
Thank you. Thank you. We have a motion and a second. Any further discussion? Seeing none, all in favor of the motion, please say aye.
Aye. Aye.
Good. Opposed, same sign. Motion passes. Minutes are approved. Thank you. We'll move on to the executive director's report. Dave, before you change that, I'm just going to snap a picture of it so you won't have to keep jumping back and forth.
Okay.
Okay. Thank you.
All right. Thanks, Dave. I'll go in and I'll provide some updates on operations, and then I'll discuss quite a few items from the most recent board meeting, which was a special board meeting. Once a year, the board holds an in-person meeting at least for one full day. This year, the board had 2 days back to back, one that was more of a business type meeting, and then one that was more of a lengthier legislative agenda type planning. So I'll go through some of those items, but let's start with some operations updates for the BSRB. One item that I'm sharing with the advisory committees and I shared with the board is about our outreach for the BSRB. We have done some creative things to try to include more people in the conversations, to make them aware of the discussions the board is having, the work that all of you individuals do on the advisory committees as well. I'm trying to put more visibility on the advisory committee because I think there's a lot of people out there that may not be familiar with how many extra voices the board tries to incorporate, bringing in licensees for each of the profession. I think there's usually between 55 and 60 different licensees that serve on these advisory committees as voluntary members. And so when you see the 12 members of the board, that's the body that takes the official action, but a lot of the recommendations the board considers are driven by licensed professionals and other individuals in the state of Kansas. And so trying to help people understand the role of the advisory committees. And one of the steps to do that is broadcasting the meetings on the YouTube channel. Leslie and I were talking with a new contact earlier this morning, and she actually mentioned that she's really enjoyed watching some of the board meetings on the YouTube channel and being aware of the discussions, and it helps start some conversations about some topics. And so that's what we're going for. We're trying to help people get more information on the website, get more information by broadcasting the meetings and having them available afterwards. And really appreciate the board's willingness to do that and the proactive nature of those conversations. So under that, I wanted to let you know that since we started the YouTube channel back in January of 2021, we have broadcast live or uploaded after the fact. I think it's now been 174 meetings, including this one. And they have been viewed, last time I looked, 9,998 times. So probably by the time I look next time, we'll cross 10,000 views. And that's really, really positive. Really am encouraged by that number. And I think that will only continue to grow as more people are becoming aware of these meetings and how available that is. I talked with a couple other leaders of small agencies this month or last month, and they referenced that they've started to broadcast their meetings, but you have to be live and watching it when it occurs. Otherwise, you're not able to go back. And everybody can do things differently, but I really appreciate the fact that we archive our meetings because then we can reference those to people. And especially if people have to miss a meeting, sometimes they'll follow up with me and say, can you give me some pointers on what I missed? And I said, well, I'd be happy to do that, but the entire meeting is right there. You can go back and watch if you'd like to. And that's just a really nice benefit. And if we have guest speakers, presenters, it's really nice. So we will continue to broadcast those meetings. In terms of some other outreach efforts, last year, we decided to do a meeting specifically as an informational forum for educators for different professions across the state of Kansas. We started with our list from many years ago in terms of our contacts for a physical roundtable discussion with some members of colleges and universities in Kansas. And since that time, we've tried to build that list and expand that list. And so we had the informational forum for educators last year, and we had about 30 to 35 people that were interested in attending that. We also did one specifically for employers of mental health professionals. And again, we had about 30 to 35 people last year who wanted to attend that. And it was a good opportunity for us to give them information about the BSRB, about the areas of licensure that we are overseeing and the trends we're seeing, some updates from the agency, and then also put together a presentation that summarized changes in law for the last several years, things relevant to licensure and some things that they may not be aware of unless they were really tracking all those legislative changes. This year, we tried to detail a presentation that was similar, but provide some information on some of the multi-state compacts that the BSRB is now a part of. We're a part of 3 multi-state compacts for the profession. And also there have been some regulatory changes. So last year focused on statutory changes, this year focused on the changes in regulation, and then some upcoming items too. So last year we had about 30 to 35 people for each one of those. This year, the employer forum, we had over 40. And then for the educator one, we had over 40. The employer one, we had, I believe, close to 60 people that had at least RSVP'd for that. And so really positive results. I think we can continue to expand those numbers. I'm aware that we very likely missed some educators and some employers, and that was definitely not intentional. It was just we're trying to do this a little bit differently. These are not an official meeting of the board or the advisory committees. These are kind of put on by BSRB staff as a service. This time we were able to record the meetings, and we did go ahead and put those on the YouTube channel after the fact. So if anybody wants to go back, you're welcome to go back and view those. They're about an hour in length. They are very similar, but there's a couple of differences based on the two different groups, but those are available. You can go and watch. Next year, we might try to even expand it a little bit further. We currently don't have a Zoom that has a webinar feature, but that's something that we could do. We just want to make sure that we provide the information in a secure format too, if we were to broadcast that. So working on some additional logistics, but really happy to report that we were able to do that level of outreach. We were hoping to kind of collect some feedback from those two groups in terms of things the board could consider, or maybe the advisory committees could discuss. I didn't get a lot of new topics that people brought up from the discussion at the end of those meetings, but still really happy to reach those individuals. And I did get some follow-ups afterwards, people requesting copies of the PDF slides. So if anybody wants those are available. And then hoping those individuals will just share what they learned and direct people to it if they have questions. So turning next to some updates from the last board meeting, I mentioned that usually the board meets 3 hours every other month. This time we had a special board meeting. So the board met in Lawrence, Kansas on September 29th, which was a Sunday, from 5:30 to 7:30. And then they met on September 30th, a Monday, from 9 a.m. until 3:30. So a long all-day meeting and then a business meeting the night before. Some of the items that the board discussed at those meetings, there was written public comment provided by an individual concerning some concerns on the licensing examination, the EPPP. That was posted on the BSRB website, but just to kind of summarize some of those concerns, some of those had to do with the EPPP2, but also the validity of the test. I think in general were a couple of the comments that were included in some of that public comment that was written only for the board. There were the normal updates for the board in terms of professions reports, updates on licensing. We are still seeing a trend of licensing continue to increase. So that is a positive aspect too. So those license totals, not for every profession, but across the board, if you take all the total licensees, we are getting very close to about 16,000 total licenses the BSRB oversees. And that's up from about 12,000 just about 9 to 10 years ago. So really positive numbers. And when you're looking at the level of clinical licensure, I do recall looking at that total too. And I believe in that 10-year history, the number of clinical licenses has increased something like 67% or so. So the number of independent clinical level practitioners has really been increasing significantly, especially in just the last few years. In terms of some items from that board meeting, the BSRB had a discussion about advisory committee expectations. So in the advisory committee policy, it does include some information, but when you review that policy, it's a fairly short policy. It talks about, the purpose of the advisory committee to consider recommendations referred to it by the board, to make recommendations to the board. And it talks about the qualifications of members. There is a statement in that policy that says the same policies and procedures that relate to the board members should also relate to the advisory committee members, but that sentence has never been fully fleshed out. The statutes require board members to live in the state of Kansas. The advisory committee policy doesn't say that clearly one way or the other. And so about 30% of our licensees we know live outside of the state of Kansas. So there has never been sort of a general rule that you have to live in the state of Kansas to be on the advisory committee. But that was something for the board to discuss if they wanted to add clarification to that. There's also not any specific language concerning disciplinary issues in the advisory committee policy. And so in the expectations for board members document, it does say that there's an expectation that board members would not have disciplinary violations. And of course, you can't control if someone were to file a complaint or not, but there's a big difference between a complaint versus a violation. And so the advisory committee policy, there was discussion about, should there be some language there directing a process if an advisory committee member were to have a disciplinary violation or things like that. So good conversations. There was also a conversation about should there be a requirement that advisory committee members have a license. So most of the advisory committee members do, but occasionally we will have someone who lets their license expire, or occasionally some of the advisory committees have accepted members that were not licensed because of other roles that they may play. So that was another discussion point. So the board did have some good discussion. I'm going to go back and try to draft up some language for the board to consider at the next board meeting. And of course, we will keep you all updated if there are significant changes to that. Looking at some of the other items from that board meeting under new business, there were a number of advisory committee members that were appointed. Those in this meeting were from the Addiction Counseling Advisory Committee, the Behavior Analyst Advisory Committee, and the Licensed Psychology Advisory Committee. I believe between this meeting and the last board meeting, I think each of the advisory committees probably had new members that they were putting forward for recommendations. And so most of the advisory committees are getting close to their maximum number of members. The advisory committee policy does say there should be a minimum of 3 non-board members and a max of 10. And so just really a positive thing to see expanding advisory committees and a lot of new voices that are going to have the opportunity to add some value to the work of the BSRB and the advisory committees. Some other items from that meeting. So for the last 2 years, I have been serving as the SIPAC commissioner for the state of Kansas, and that commission is going really well. That multi-state compact. Kansas has had about 100 individuals with a home state license in Kansas that is practicing under that compact. But the BSRB has joined a couple of other compacts, the Professional Counseling Compact and the Social Work Compact. And the Social Work Compact is the most recent one, and they have asked the BSRB to appoint a compact commissioner for the Social Work Compact so that the Rules Committee can start to develop those rules. And so at the last board meeting prior to this, the board appointed me to serve as the Social Work Commissioner for the state of Kansas. And so I am transferring my position as the SIPAC Commissioner to Dr. Richard Nobles. He is a licensed psychologist on the board and also the chair of the Licensed Psychology Advisory Committee. There is an annual meeting coming up in November that he's not able to attend. So basically what the board decided is that I will attend that meeting as commissioner for the SIPAC Compact, and then right after that, Richard will become the new commissioner for SIPAC, and so I'll transfer that responsibility to him. And in the meanwhile, I can work with him to get him up to speed on those responsibilities. Other update, the Social Work Multi-State Compact does allow there to be a backup commissioner. So not all the compacts do allow that, but the Social Work one and the Professional Counseling allow a backup commissioner. So the board appointed Andrea Perdomo Morales. She's one of the social workers on the board and the most senior social worker on the board to be the backup commissioner for the Social Work Compact. And so if I'm unavailable, she'll be able to serve as commissioner for the Social Work Compact. Some other items that were considered, there were some recommendations from the advisory committee to the board. One of those recommendations was from the Licensed Psychology Advisory Committee and from the Master's Level Psychology Advisory Committee that had to do with concerns about the Association for State and Provincial Psychology Boards, ASPPB, the licensing exam, the EPPP, and specifically the new upcoming requirement from ASPPB that as of January 1st, 2026, any states wishing to continue to use the EPPP would have to include as a requirement passage of not just the existing EPPP, which they will call Part 1, but also the EPPP Part 2. And so Texas had put forward a proposed bylaw amendment to address this topic. They are planning to have that up for discussion and a vote at the ASPPB annual meeting here in about a month. And so the question that was posed to the advisory committees was to support the proposed bylaw amendment, and both the LPs and the Master's Level Psychologist Advisory Committee recommended the board support that proposed bylaw amendment. And so the board did hear that recommendation, and the board did agree to go ahead and support Texas's proposed bylaw amendment. So at the annual meeting, I'll be attending that representing the state of Kansas, and I will speak to the group and advocate for the bylaw amendment to be passed. And that bylaw amendment will give states the ability to determine if they should make that a requirement or not. Some states have already adopted the EPPP Part 2, but only about 2 of them, I believe. I think it's just Nevada and Georgia so far. There have been some other Canadian provinces and a couple of territories, but only 2 states voluntarily have done it so far. But with this bylaw amendment, if it passes, all states will have the ability to make that determination if they want to do that or if they don't want to do that. Looking at another recommendation, the behavior analyst recommended the board consider legislation to add a board member for behavior analysis. And the board agreed to go forward with that and request legislation for that item too. The Social Work Advisory Committee had a recommendation to essentially last year in a bill. This was a bill originally put forward by the BSRB, and then some committees made some changes to it. But it was 2023 sub for Senate Bill 131. And there was an amendment made in committee to adjust some of the qualifications for clinical level social workers. And so for individuals seeking a clinical level licensure, there's a certain amount of coursework that needs to be done in each of the professions, basically to ensure there's coursework and training, diagnosing and treating before someone can do that independently. And so for the social work profession, that amendment in committee struck the requirement of 4 of the 5 classes that were included in the statute under the diagnosis and treatment requirement. And so the only course that was left in that section of the statute was a requirement to take a psychopathology course for 3 hours. Additionally, within the 3,000 hours of postgraduate experience, there was language that 1,500 hours would need to be in diagnosing and treating individuals. And the language was modified in that bill that of the 1,500 hours, it would include, but be not limited to, diagnosis and treatment. And that sort of muddied the water in terms of how much of the hours would need to be diagnosing and treating, because it wasn't that these 1,500 hours would be in that topic. It's that the 1,500 hours would include, but be not limited to, the diagnosing and treating. And so one of the recommendations from the Advisory Committee for Social Workers was to essentially request the board pursue legislation to reverse those changes, to add them back to the statute, but recognizing that there might be a need for individuals to practice independently that may not want to diagnose and treat. Some states do offer a license type for social workers that is called an advanced generalist. It is an independent level license, but it doesn't give authority to diagnose and treat. So it would be sort of a top level license for the social work profession. It just would not authorize someone to diagnose and treat independently. So their second recommendation was for the board to ask for legislation creating that new level of license. And we are currently trying to expand the communication with different groups. And I've actually reached out to a lot of the professional associations recently to set up regular meetings with them to talk about different topics. And so what the board decided to do was to table discussion on the 2 social work recommendations and ask for to see if the BSRB and the social workers and BSRB leadership could work with NASW Kansas to see if they might be able to collaborate and work together on some of these proposals. And so we're trying to set up a meeting between now and the next board meeting to see if we can work together before the board really finalizes all the items that would be included in a bill before the legislature. There is another recommendation that was forwarded from the Addiction Counseling Advisory Committee. This would be having to do with the language in their Practice Act. Basically, that act said that individuals would not be able to provide addiction counseling services unless they're licensed, but it had some carve-outs. And one of the carve-outs was for people who are students or interns. But there was some additional language that said, or individuals preparing for the practice of addiction counseling. And preparing for the practice was not defined anywhere. And there was concern that individuals could be practicing without a license under that vague term, preparing for the practice. And the only other profession that we saw this in was in the statutes for marriage and family therapy, which we think the addiction counseling statutes were based off of. And so to my knowledge, and we've asked different individuals about this, we can't come up with any kind of language about that preparing to practice, what that is rooted in, or if there are specific individuals that was targeted to enable to practice. And so the real important individuals under that section are really the ones who are students or interns. And so the board is kind of faced with the decision of, do you either strike that language that is unclear, or do you add a definition? And the Advisory Committee for Addiction Counseling, their recommendation was to go ahead and strike that language. And so the board agreed to go ahead and do that and referred the similar topic to the Marriage and Family Therapy Advisory Committee to see if they would have a recommendation to the board for the same thing for their section of the statute. So that's where that ended up. concerning the recommendation that the addiction counseling had for the licensed student addiction counseling licenses. Basically, that was something that was passed last year. It is a temporary student license for the addiction counseling profession. It has been very popular since that point. We've had about 40 people, I think maybe more, who've been able to obtain that. They have to have 60 hours of coursework with an emphasis in addiction counseling or a related field, have an agreement to be able to work in a facility where you're under supervision, and then you're able to work for those 2 years. You have that student temporary license. And then when you complete your degree and are able to get the requirements for the full license, then you can get your LAC. And so this was a nice little way to kind of bridge that process. And it's been very popular. I've heard from some people there are some issues with the reimbursement for that level of license, as it is a pretty new level of license. So we'll be continuing to have conversations and see if we can be helpful in those conversations. But there was a modification the board was requested to make that would open it up a little bit more for individuals who were maybe had a bachelor's degree, but it was not in one of those fields, but they are now enrolled in an addiction type program to allow those individuals to also have a student type license. And so the board was supportive of those changes, but asked to see some language specifically on that. So we'll be bringing that back to the board in November. Moving next to some of the topics that were discussed at the all-day planning meeting, we went through and provided an update on BSRB licensing and some other information about the agency and fees and different topics like that. I'm happy to report that in looking at some of our licensing information for the last 3 fiscal years, at least by one of the metrics that we have looked at, our licensing timeframes have decreased, going from fiscal year 22 to 23 and going from fiscal year 23 to 24. So during that time period, we've been able to find some new efficiencies. We've also been able to expand our staff from 9 individuals. Now we have 12 individuals, and some of those are in really targeted roles to help individuals out. And we have a lot more people applying for clinical level licensure. So now one of our staff members is really focused on reviewing and approving those training plans. But we've found some really positive efficiencies, and our overall time frame for licensure is going down. We're continuing to work on more of those efficiencies, and the board recently voted to go to a new licensing system, which should help us with some of the processes that are now separated. We should integrate those. So we're looking forward to some additional positive changes too. Concerning some other topics, the board had a discussion about supervision for professional counseling and marriage and family therapists. Currently, right now, there is a discussion about their regulations that require board-approved supervisors for both those professions. There have been some concerns from some individuals about availability of supervision or requests to have alternate supervisors. There is some language that allows that, but calls for there to be a really extreme situation and extenuating circumstance. And so we now have a proposal that both of the advisory committees can consider concerning an alternate method for us to look at supervision for those professions. And that has been referred back to the advisory committees to look at, to see if they want to make a recommendation on any changes prior to legislative session, to see if we can have any additional flexibilities there. Additionally, the board had a discussion about an expedited application review process. So that is something that we are working on as an agency. We do have authorization to go ahead and put that into place through the rules and regulations process, but we were struggling to really find a good process, because there's really no comparable process for the agencies that are similar to us in the state of Kansas. And in talking to individuals outside the state, I haven't found any other similar agencies in other states that have something like that in place. But in talking with the board members, I think we now have a better understanding of how we can maybe design something that'll be helpful and help people understand maybe some of the cases where if we have certain items, we can process an application more quickly. But unfortunately, in a lot of cases, some of the timeframes are outside of our hands. But that's something we'll be drafting up and presenting to the board at the November board meeting. And if they okay that, we'll go forward with that in the rules and regulations process. Additionally, we brought forward an item for the board. This is a regulation in the state of Texas that is open for review. It would allow the board flexibility to take care of remediation if there were small deficiencies for an applicant applying for licensure that were based on something in the regulation. So it would not overstep the statute. The statute would still provide what had to be required. But if this was something that the board could go forward with, it would allow the board a choice. If somebody had attended a non-accredited program, let's say, for example, and one of the alternative requirements in the regulation was not met, instead of just denying the person for licensure, this is a method the board could use to go ahead and see if there's an additional step the person could do to solve that through remediation versus rejecting them for licensure. So we're going to clean that up and make it a little more suitable for our regulations, but I think there was some positive comments from board members, and I think it'll be a nice helpful tool if we can have something good in place for the board to consider. We also were talking about review of academic programs independent of a license applicant. We do have some schools that come to the BSRB and say, could you review our program and make sure that we meet the requirements for licensure? The problem is our regulations and statutes are written from the perspective of the applicant. So when the applicant applies for licensure, they provide an application fee. We review the program at that time, in part using the application fee to pay for our hourly services from the individuals reviewing the coursework and the program. So for individual programs that come to us directly, there's no way for the BSRB to accept a fee to do that level of a review just for the program. But there are some states who have things set up in place for a small fee. They will use staff time to do that, independent of an applicant. And so we brought that to the board and we said, you know, we want to be good custodians of our time. And if we're doing services for someone, it makes sense that there should be a fee attached to it. And we think that there would be some schools that would voluntarily pay for this service to be able to get that, you know, confirmation that their program meets the requirements. It would not be required. No school would have to do that. But if they wanted that assurance from the BSRB, there would now be a way, if this goes into effect, that we would be able to collect a small fee to do that type of review and use our staff time for that review. So that would also be a path for individuals to do that from the beginning too. So if somebody was saying, I'm interested in looking to see, do I meet the requirements if I go to this program, they could submit that too and pay the small fee and get that decision as well. We are talking with the board about allowing the professions to be able to voluntarily, individuals who want to provide continuing education. Right now for the social work profession, they are able to request to be a specific board approved supervisor, or not a supervisor, a board approved continuing education course, or a board approved CE provider. So the social work profession has that already in place. It's a voluntary thing they can submit for, but if they are approved, then they can hold that out. And there is a way to have individuals verify that their CEs would meet the requirements under the BSRB. But right now it's only for the social work profession. We brought this to the board and said, now that the board is moving to working with CE broker, there is now sort of an easier path for these programs to submit materials for review. And we think this could be a way that individuals could be willing and interested in providing a fee to the BSRB for this kind of verification. And also, if we collect some additional revenue from these CE providers, we may be able to have additional flexibility in looking at fee decreases for our licensees. So the board was supportive of that. We're going to draft something up for them to look at on paper at the next meeting. And then just one additional note, the board is continuing to have a conversation about a possible student level temporary addiction counseling license for the graduate level students, but that still needs some additional conversation by the advisory committee. And then the last item I'll talk about here is a big one. The BSRB had a conversation about our current fees and our fee fund balance for the agency. The board significantly lowered fees for a lot of applicants back in 2019, really decreased the renewal fee for license renewals, decreased the application fees for individuals as well. Since that time, the balance in the fund has gone down, but we're still sitting at about $1.8 million. Our average expenditures for the year are right around $1.1 million. And so we're going down, I'd say roughly around $200,000 per year. But we have some flexibility here, at least for a short time, where we could potentially have the board consider additional fee decreases. So the item that the board went ahead and voted on was the board made a decision to go ahead and decrease the original license fees for all the professions that have an original license fee by $50. And so that'll be a nice decrease for people originally starting out in these professions. And so that is something for the board that we'll be moving forward with in the rules and regulations. The one profession that's an exception is the licensed psychology profession, just based on some of the unique aspects of that profession. They have a higher application fee and a lower original license fee. So there still will be a $50 decrease, but it will be a $50 decrease to their application fee. For all the rest of the professions, it will be a decrease to the original license fee. And we think this will probably be an estimated decrease in revenue of about $75,000 per year. But I think we can absorb that with the other fee decreases, at least for a few years, and then we can look and reevaluate. At some point, we will need to stabilize, but we're trying to draw down our fee fund balance in a really positive way, but in a safe way. And so I think we can do that and then reevaluate things in a couple of years, and then probably not have to make any changes, I would guess, for another maybe 3 or 4 years. I know it was a lot of material, but it was a very, very good board meeting. So I wanted to share all that with you. So I'll end my report and see if there's any questions.
Thank you, Dave. Questions?
What would, can you say anything more, Dave, about the graduate student license possibility?
Sure. Yeah, so we had talked about that for the licensed addiction counselor profession. That the group who had requested that, similar to the one that passed last year. We don't have a real great model yet for the board to consider, but one of the concepts was a way to differentiate it from the LAC student temporary license. At least with that one, it's 60 hours of coursework that's already been completed. For the graduate programs, that wouldn't really work the same way because of the difference in number of hours. But perhaps there could be something where you have someone who's completed, let's say, 30 hours of coursework, and so you're halfway through a program. Maybe that would be a nice alternative. But right now, there's just conversation. We've had a guest presenter to the Addiction Counseling Advisory Committee with some options, but the advisory committee needs to discuss that a bit more before it's actually a proposal for the board.
No, thanks.
Any other questions or comments?
I had a conversation with a social worker just this week about clinical hours and how they're obtained. And so I think it's interesting that you brought that up because she was saying, with social workers, she was seeking her, or maybe she has her clinical license and she got it all through a school setting. And I thought, I don't think that would work for other professions. It's just interesting how where they can get their clinical hours how that looks so different for each profession. So that was interesting to hear you talk about that.
Yeah, Leslie might be able to comment on that a little bit.
I was going to say, so there are, the school districts differ greatly. Some are very specific. They will not be treating, but there are some school districts that allow diagnosis and treatment within their student population. So
Yeah.
she must have been somewhere where she could do both.
Yeah, and we do have it in Wichita. There's just a couple of us that do it, but I don't know for sure who her supervisor was, but yeah, that's interesting.
Yeah.
All right, thank you, Dave. As always, great report. We'll move on to old business and a continued discussion on possible survey of licensees.
Yeah, and I'll just have a short report on this topic. You all reviewed some potential draft questions last time, really good feedback. It looks like David Stevens is now entering the meeting as well, so he's in attendance. But concerning those questions, I have continued to work on those with some other advisory committees. One item that some of the advisory committees discussed was having a possible definition for frontier areas. And it looks like, from what I have seen, it looks like one of the definitions out there is that is a population density of fewer than 6 people per square mile. So I thought that would be a good definition to include in that if individuals wanted to say that's the predominant area where they provide services. There was also a question on workforce that was trying to gauge how much of their time is being spent on direct services. And since we do have some individuals that have more than one license, I thought maybe adjusting that question that said, instead of how much of your work is on direct services, maybe what percentage of your work is on direct services to clients using your LMLP or LCP license. Because the billing is outside of a lot of what I do because I'm not an LPP or an LMLP, but I would assume that those who do provide those direct services, billing under a certain license is probably part of that process. So maybe that's a way that can be quantified. That way we don't, double count or miss somebody because of the different multiple licenses some people have. So those are the only 2 tweaks. I'm still planning to send this out. but it'll be probably sometime between this meeting and your next advisory committee meeting in December.
Very good. Thank you, Dave. Any questions or comments about that? That moves us to continued discussion on the regulation of artificial intelligence.
Just kind of wanted to open this up for the advisory committee. The board is going to be having a discussion in the future in terms of how we can address this topic. It was helpful. I went to American Family Therapy annual meeting about a month ago, and they were talking with states, and some states have not even started the conversation on this topic. And so we were able to bring it back and say, our board has started the conversation. They referred this to each of the subcommittees for the board, the advisory committees, and we're really delving into this on a profession by profession basis. And so we are ahead of the game compared to some, compared to where artificial intelligence is. Maybe we're a little behind because, you know, technology moves fast. But just wanted to open this up and see if anyone had any thoughts since the last meeting in terms of maybe ways that we can recommend to the board that they approach this, either from an unprofessional conduct standpoint or a practitioner responsibility standpoint, another section of the regulations or the statute.
Dave, have they discussed specific examples or circumstances where AI is being used that they're looking at?
Well, that's actually one of the survey questions, would be to kind of collect some information about how practitioners are using that. I have heard that some individuals are using AI tools in terms of their notes from sessions, and making sure that that is a closed process, that information is not being shared if it is confidential. That is one tool that I have heard some people using. The only other thing that comes to mind right away is, you know, it escapes me. I had it and I lost it, but I think part of it is also making sure that everybody's in agreement with what is artificial intelligence. And I think some people may be using a tool that they don't see as artificial intelligence, but there may be aspects embedded into it that are. So that's probably part of this too.
I think you had brought up, I think it was a couple meetings ago, that there was a website out there or a agency or group that had some kind of AI on their website, and then it was giving really concerning feedback. I think it was specific to eating disorders.
Yeah, I had read an article about that where they had changed their live chat from people to
AI.
bots, and it had
Uh-huh.
really gone off the rails in terms of the advice it was giving people. But they shut that down pretty quick. The rest of you aware of examples of where this is being used?
I've heard of some practitioners using it for notes already. I'm not super up on AI with responsible ethical systems and all that sort of deal, but I've heard of a couple of clinicians using it. I think it's, I don't know, or maybe a couple years out from all of our EMRs having it embedded within our systems anyway. I'm kind of waiting for that to happen. So I do think there should be stuff around it, especially for what that eating disorder example. But in terms of notes, I think, I mean, in the interim, yeah, there's people, we need to be careful of the systems people are using. I think there's great risk there, but in all likelihood, within a couple of years, I think they'll be embedded in all of our EHRs anyway. And so that'll be good because those are very HIPAA compliant and all that. So.
There's a couple of Facebook groups that have their whole basis is how different ways therapists or clinicians can use AI. I've joined them. I've kind of followed them a little bit to try to understand more. A lot of it is about note taking, but some of them are talking about how certain types of, there's some new ones out there that some medical professionals are using to like input symptoms, and then that kicks back some diagnosing to kind of, and so I don't know how far that is and really where that's at, but just kind of following the discussion on that too.
And this is Kari. And obviously we're talking about the medical there, but that's concerning for me that they're using things to diagnose. Just because, we use a DSM as a measure, but we have to also go off our clinical judgment in the full conversation.
Yeah, I agree with you. I feel like all of this stuff just kind of gives me a weird feeling. Maybe I'm too old school with it, but I don't know AI, how that would work in our profession. Maybe report writing, if I'm given a standard IQ test and it can fill in the gaps for me. I don't know. Other than that, I don't know. I don't even know where to start with or how to have this conversation. I'm not even sure what it would look like. It's concerning that people would turn to something artificial for any type of support or therapeutic interventions. That feels a little bit strange to me, but maybe it's not as, I mean, they go to websites all the time with, self-help or ideas on how to get, if I'm struggling with this, what can I do? Or my family is giving me a hard time. What can so people go online, is maybe it's not that much different than Googling self-help, but I don't know. I feel a little bit naive with this whole area. Just
Not to,
don't
but
know.
and to add to that too, Rebecca, I mean, how many people diagnose based off of what the BASC says,
Oh
or
yeah, for
right? So
sure.
like, I'm a big believer in clinical judgment, and I don't like assessment for the most part for those reasons. But how many people use the BASC or the Connors or whatever and say, okay, yeah, well, and it's like, well, no, he doesn't have ADHD, but yes, the
Yeah,
BASC says that he does.
right. Or
So
the
that,
internet, people will come in and be like, well, I read I have all these symptoms and I'm bipolar, or because they read it online. So maybe I don't, maybe the whole AI aspect isn't as different than what we deal with already. I don't know. I don't know.
which goes back to Dave's original point of, I think defining it is probably a pretty difficult thing at this point in time.
Now, I know there are some online like CBT programs that have been found to be really helpful that just essentially walk people through um, CBT interventions. And then the one I read about had a therapist checking in with them periodically as they progressed through what was mostly kind of already scripted out. And
Is that, Dave, is that consider AI? Is that considered an artificial, or I would assume a person
sure,
makes that program, or is that program made artificially? I don't know.
I think it's like step one on that pathway where you start to get things that are, but I think to Josh's point, there's no heading off modernity. We're headed in the direction of things being different. And, there's probably people out there who make the argument that if you take to a certain extent people and their biases and their preconceived notions, their bad days, their whatever it is, their responses to certain people out, you might actually get somewhat better interventions in certain circumstances. So it will be interesting to see as we go. Dave, have there been other more specific examples that you've heard about from the other groups?
Everything is kind of at a high level right now, but similar feedback from different groups.
It's just a question. How would AI come up to a licensure question? Because it seems to me like the issue that we could support the community with would be some kind of guidance to say, here's how AI could impact licensure, whether it would be a complaint, and then just making clear, HIPAA applies or doesn't. I don't know.
Good question. So I think one way potentially that it could come to the BSRB is, let's say that you had a client and they gave confidential information and the practitioner was using a tool that had AI, and the client was not aware of that. and then the AI tool had a data breach, and someone gets some of that confidential information, and they could say, well, I should have been informed by my practitioner that they were using AI, and I was not. And so that could be one way, because a lot of this is going to be driven on how can we make a requirement for practitioners. We don't generally say what are the best practices, but we could say, it would be unprofessional conduct if you failed to do X, Y, Z. And so part of that may be adjusting the unprofessional conduct in terms of informed consent, or duties in terms of confidentiality. But that's one way I could see it coming up.
Would that be that dissimilar from like an EHR system getting hacked and taken? Like fundamentally, would that be that different? Like, and how much is that the fault of the practitioner? Like if my EHR system gets hacked and all their, I don't know. I don't have an answer to that question. That's a semi-rhetorical, but
It doesn't seem a whole lot different. I
Yeah,
see
but a lot
what
of times, if you read your consent, a lot of times in consent, it will outline the use of an EHR and the risks held within that, right? So, mm,
I think the hard thing is going to be, again, there's no answers here. I think it's going to be hard to know like where our jurisdiction as a licensing board lies, because something like AI, like a person, you can say, where do you reside? Are you as far as licensure, where do you reside? Do you reside in Kansas? Do you not? Have you done, but an AI, I mean, I don't, a lot of the things that we apply to people that we license, that seems like it will be hard to apply to a non-person entity. And I don't know, like maybe it's the people who make it. I don't know, but that's feels hard. It's gonna be who do we have jurisdiction over?
That's a good point. There's two different things. It's kind of like, if the chatbot provides bad information, how do we go after the chatbot? And then you could follow the fruit of the poisonous tree per se, in terms of going back and tracking who created the chatbot and, going that direction. But part of it too is the tools that people are currently using. And I think that's where we have probably more flexibility for guidance or control. And it's been my experience that most of the licensees under the BSRB try to do the right thing in most of the cases. And this could be just an opportunity for us to put a spotlight on a specific topic by adding something to the unprofessional conduct regulation, and then increase mindfulness by practitioners. So even if we aren't, it would be difficult to ensure that everybody is absolutely doing these things. Bringing it to their attention might be helpful, just to make sure that when they're considering what tools they're using, they're keeping them.
Yeah, back to the earlier point too, it would seem like with the CBT, that was probably created by clinicians, but I've seen examples now where people will say, punch into an AI, create a PowerPoint presentation on this topic, and so will that be kind of an increasing part of the role of AI in generating kind of material? And is that material then being used in the practice? And so kind of to Dave's point is, it's really how it's being used by people who are licensed by us. And to kind of what Josh said is, are they making people aware that that's one of the tools that they may be using, and have people consented to that?
I can speak a little bit to the question that was raised earlier. I mean, I do think the EMR question or comparison is apt in a couple ways. Number one is, even though the EMR might get hacked, at least under HIPAA, the covered entity, which is the provider, is the one who's ultimately responsible. And that responsibility goes back to notifying the patients. So if there's a hack, then the provider is the one that ultimately has legal responsibility for notifying the patients. They may delegate that notification to the company that they hired as part of the remediation for the hack, but in the same way, the provider is the one that basically determines what technology they use. And I think that's the point David was making earlier is, the provider is choosing what tools to use. And at some level, they are then accountable and responsible for if they share data about a patient with that entity, they will ultimately have the accountability for that. So I think it is about tool deciding with some sense of responsibility what tools you're going to put your patient data in.
Does anybody know if it's included in malpractice insurance now? Like, is there anything in like a, now I'm just curious of if that language is listed in there at all. Do you know, David, if it's in there, or does anybody know?
That's a great question. I don't know the answer off the top of my head.
I know that I don't know about malpractice specifically, like you're practicing malpractice insurance. I know that I have additional insurance for if we get hacked and if that sort of thing, like electronic type stuff. So
Cybersecurity
yes, thank you.
is probably the more applicable.
It's in
Yeah.
addition to your regular
Yeah,
malpractice insurance?
yeah,
Oh,
but
okay.
it was low enough, and in today's world, seemed likely enough that
I guess I just assumed my other one would have it, but probably maybe it doesn't. I don't know. I need to look into that now that we're having this conversation.
yes.
And that might be the kind of guidance that would be helpful, is
Yeah.
to say, you should inspect both your malpractice and cybersecurity insurance to determine whether or not you have coverage for if one of the tools that you select results in some kind of a licensure concern.
This is going to be, without a doubt, a fascinating topic for future discussions. I can't imagine we're going to be able to escape this in a more specific circumstance for very much longer. But if you come up with things, you think about things, please, forward those to David. I realize we have 3 Davids in this group, so you can never have too many Davids in a group, I always say. Any further discussion? If not, we'll move to the continued discussion on adding a description of each profession to the BSRB website, designed to inform the public of the differences between the professions.
I'll go ahead and frame this as part of the conversation. We've had a number of tools that we've tried to add to the BSRB website to help licensees, members of the public who visit the website. And I think one of the areas of confusion sometimes can be that while we oversee 7 different professions, there can be a lot of confusion between the professions we oversee and the levels of licensing. For example, we use terms that mean something in Kansas that may mean something different in another state. Things like even as simple as licensed professional counselor. For some states, that's the clinical level of counseling. For ours, we're one of 2 states that has a level of licensing below the clinical. So we have licensed professional counselor and licensed clinical professional counselor. Not all states license master's level psychology. Only about 17 states do. And the terminology they use for those types of licenses is vastly different, one state to the next. They're trying to work on some, guidance to have more areas of commonality, areas where states can kind of be more similar, but we're not there yet. And so part of this is being driven by, we have the legal definitions and the statutes. So we do have good technical definitions, but for members of the public who are trying to understand, what is this license? What is this profession? It would be helpful for us just to have a little paragraph or more that would help explain what this is and who are these individuals who hold that level of license. Each of the advisory committees is working on this for their profession to send back some recommended language to the board. The Social Work Advisory Committee met yesterday, and what they decided to do, I thought worked really well, they actually had some members of the advisory committee just volunteer. There's 3 levels of permanent license. So 3 different members of their advisory committee, 3 different people each volunteered to take a level of license and then just to come up with a basic paragraph that said, licensed bachelor, social worker, work traditionally in these types of settings. They typically provide these types of services. Based on their level of license, they're not able to diagnose and treat. Another example is the master's level social work, where they talked about individuals there and what type of education they would have had to complete, what settings they generally work in, what types of services they generally provide, and that those level of individuals are able to diagnose and treat, but under supervision by someone who has the appropriate level license under the BSRB. And then for the clinical, they have the same type of description, and then that they're able to diagnose and treat independently, that kind of thing. And so they were able to have that brought back to the committee by certain members. And then the committee could kind of work on those draft examples. So I thought maybe I would just suggest that today, kind of explaining the broad framework of what we're looking for, not something that's, a really long definition, but something that would be helpful and with that target audience in mind too. But these are not technical definitions that are meant to include everything, but something more for members of the public to better understand the profession. And I think, especially because we use an unusual title for the clinical level of master's level psychology, licensed clinical psychotherapist, it would be helpful to kind of explain what that level of license is and what it means and what they can do. So I thought if you all are okay with it, we could throw that out there, answer any questions if you have questions, and then see if a couple members of the advisory committee would be willing to volunteer to take on one level of license and come back with a paragraph, and then we could work on it together at the next advisory committee meeting.
Volunteers. Is there anyone who didn't show up to today's meeting?
Iris, he said
I'd be willing to give it a shot too.
I can do LCP.
And Kari, would you be willing to do LMLP?
Yeah, I'll give it my best shot and bring it in.
Well, thank you both.
I do have some other thoughts on that. I don't know if there's ever any solution to this, but I was thinking about this the other day. I think filling out some kind of form, but I don't know. I'm guessing the rest of you come across this too. I mean, LMLP, LCP is never on any form that I fill out. Whether I need to start writing down all the different examples, but just any state form, insurance, surveys, it's just always, I mean, I don't even know what to mark usually because I feel like I can't mark LP because that's higher, but I'm really not LPC, it's just, that is frustrating. But definitely, yeah, just not not recognized or understood.
Yeah, completely agree with that. It's
Maybe
frustrating.
Maybe once the APA starts, whatever with our programs, we'll get some letter props.
That would be awesome.
Dave, did you get what you need on that one?
Did, and really appreciate you both volunteering. If you would like to take a shot at drafting it, you're welcome to bring it back to the next meeting, or if you want to go ahead and send something to Leslie Allen and myself in advance of that meeting, we'd be happy to take a look at it and help you with the draft to make sure that's ready for the next meeting. But really appreciate you both volunteering to work on those things.
You're welcome.
That takes us to new business and a discussion on possible topics for 2025.
We're getting close to the end of the year. We have talked about most of the items that we wanted to bring forward to you for this year. I did start to look at a couple of older regulations that have not been updated or modified in some time, and probably a few of those will need to go in front of the advisory committee for some review and possible adjustments next spring. And I will put down the item to bring back for the next meeting in terms of people taking the EPPP again prior to completing their 3,000 hours. So that'll definitely be something to bring back for the end of this year. It might spill over to the beginning of next year, but thought it might be a good opportunity now to at least get you started thinking about different topics, so that if you want us to pull any data or look at anything, we can be prepared for that to have more discussion next year. So.
We are scheduled next to meet on December 4th at 1 p.m. over Zoom. If we have no further business, I would accept a motion to adjourn. Thank you all again for your participation, and really appreciate taking time out of your busy schedules, because I know that you are very busy people. I think the work that's been done already this year has been just very impressive from this committee, and the board certainly appreciates hearing from the advisory committees and being able to, it's been a very interesting process, and Dave alluded to that the advisory committees sometimes take things to the board, and it doesn't necessarily mean the board kind of rubber stamps everything that comes out of the advisory committee. Sometimes we have really robust discussions and ask them to go back and look at other things. So that's part of the importance of these groups. So thank you for your efforts on behalf of the profession and the board. Motion to adjourn.
Second.
I'm going to give you the primary and ask somebody else to second.
Second.
Thank you. All right. All in favor can either say aye or just sign off, and have a great rest of your week.
Thank you.
Thank you, you too.
Thank you.
Thanks, everyone.